Right. So we've got this 10-minute video clip about vaccines.
Yeah.
It features Dr. J. Bhattacharya,
Okay.
and he dives into some interesting territory
Yeah.
about COVID-19 vaccines,
Yeah.
myocarditis, and just vaccines in general.
Vaccines in general.
So let's unpack this together.
Sounds good.
What struck you about how he approached this whole topic?
Well, I think it's fascinating how he uses this risk-benefit lens.
Okay.
Really emphasizes the importance of age
Yeah.
and individual circumstances when you're considering the COVID-19 vaccine.
Yeah, instead of just saying, like,
Exactly.
vaccines are good or bad, it's like a more nuanced view.
Right. It's not a blanket statement. It's
Right.
really thinking about
Yeah.
the individual.
So what stood out to you in that regard?
Well, one of the things that really struck me was his point about the potential benefit of the COVID-19 vaccine for young people,
Okay.
particularly children.
Yeah.
He argues that their risk of dying from COVID-19 is already incredibly low. So the vaccine's benefit for them might be minimal.
So it's like, if the risk is already so low,
Right.
is it worth potentially taking on even a small risk from a vaccine?
That's the question.
Yeah, that's a tough one for parents.
Yeah, it is a tough question.
But especially...
And then he contrasts that with older populations,
Right.
where the risk of serious illness or death from COVID is much higher.
Yeah.
And that's where the vaccine's benefit potentially is greater.
So it's all like
It's a calculation.
a risk calculation.
Yeah, a risk-benefit calculation.
Interesting. And that's where he brings up myocarditis, right?
Yes.
Inflammation of the heart.
Exactly.
At the potential side effect of the COVID-19 vaccine.
Particularly in young men.
Especially in young men.
He seems concerned about that.
Yeah. And he doesn't shy away from the controversy there either.
No, he doesn't.
He even suggests that for young men,
Yeah.
the risk of myocarditis from the vaccine might be higher than the risk of getting it from COVID.
From a COVID infection itself.
Wow.
Yeah.
That's a pretty bold claim.
It is.
Does he back that up?
He does.
In any data?
He does. He points to studies that found a range of like 1 in 2,000 to 1 in 10,000 young men developing myocarditis after getting the vaccine.
Okay.
But remember, he's framing this within his argument that the benefit of the vaccine for this group is already quite small.
Right.
So if the risk of a potential side effect outweighs the benefit, then that really raises questions.
It really makes you think about how individual circumstances should be considered.
Absolutely.
Yeah.
Individual circumstances.
When assessing this.
And how those might shift depending on the person.
Yeah. And this is where he sort of moves into this whole vaccine and autism myth.
This myth that just won't seem to die, the persistent myth.
What do you say about that?
He tackles it head on.
Okay.
Directly addresses the flawed study that was published in The Lancet that initially fueled this fear. And he really emphasizes that large-scale studies have found no correlation between the MMR vaccine and autism.
So he's going with like the weight of evidence.
To weight of evidence.
To counter that original study.
Absolutely.
What kind of studies is he talking about?
He mentions some very robust population-based studies in the Netherlands and Denmark.
Okay.
Which are considered to be very reliable from a scientific standpoint.
I see.
But then he brings up this ethical dilemma.
Okay.
Even if you as a doctor believe a vaccine is beneficial, conducting a randomized controlled trial would require withholding it from some children for the sake of the study.
Right.
Is that even ethically justifiable?
It's a tough question.
It really highlights the complexities of vaccine research.
Yeah.
We can't always conduct the ideal studies.
Right.
So we have to rely on the best available evidence while navigating these ethical considerations.
So in the case of MMR?
In the case of MMR, the evidence overwhelmingly points to no link with autism.
So even without those randomized controlled trials?
Yes.
The evidence is strong enough.
The evidence is strong enough
to debunk the myth.
That's the point he's making.
And it really speaks to the responsibility doctors feel to protect their patients.
But also adhere to ethical research practices.
Yeah, what a balancing act.
It is a balancing act.
So we've covered a lot already.
We have.
We've talked about the risk-benefit analysis of the COVID-19 vaccine. Especially for younger demographics.
Yeah.
Debunking the vaccine autism myth.
Right.
Touched on the ethical
complexities
of vaccine research.
Yeah.
But he doesn't stop there.
He does not.
He goes on to talk about herd immunity.
He does.
And different types of vaccines.
Different types of vaccines, including this interesting concept of live attenuated vaccines.
Okay, let's dive into that next.
Sounds good.
I'm curious to see where he goes with that.
Me too.
Yeah.
So picking up on this idea of herd immunity,
Okay.
this is really key to understanding the impact of vaccination on a larger scale.
Okay, so even if my personal risk
Right.
from a disease is low,
Yeah.
my decision to get vaccinated could impact
Exactly.
other people.
That's right.
Yeah.
Dr. Bhattacharya explains that when a large enough portion of the population
Okay.
is immune to a disease,
Yeah.
it becomes much harder for that disease to spread.
So it protects.
And that ends up protecting not only those who are vaccinated,
Okay.
but also those who can't be vaccinated.
Like babies.
Exactly, like babies who are too young for certain vaccines,
Right.
or people with compromised immune systems.
So it's like a
So it becomes about collective responsibility,
responsibility.
not just a personal choice.
Right. And he also talks about the potential consequences
He does.
of low vaccination rates.
If too many people opt out,
Yeah.
overall immunity levels drop.
Yeah.
And that can create opportunities for outbreaks to occur.
And he connects that back to the MMR vaccine,
Yes,
right?
it does.
Where
Measles, mumps, rubella.
can have some pretty serious consequences.
Yes, especially for those vulnerable populations.
And it kind of comes back to that.
And it circles back to that ethical dilemma that doctors face.
That's so much. Yeah.
You know, they believe in the vaccine's benefit,
Right.
but they grapple with
The ethics
the ethics of these controlled studies
of the pendulum.
that might leave some children unvaccinated.
Yeah, it's a tough.
It really emphasizes the weight of those decisions.
Yeah.
And this constant balancing act between individual well-being
Yeah.
and public health.
Public health.
Yeah.
So speaking of different types of vaccines,
Yes.
he
He
mentions
mentions live attenuated vaccines.
live attenuated vaccines. What are those?
This is where things get really interesting.
Okay.
So there are two main types of vaccines.
Okay.
Live attenuated vaccines use a weakened version of the virus,
Okay.
while inactivated vaccines use dead virus particles.
Okay.
So both stimulate the immune system,
Okay.
but in different ways.
So the live
This
attenuated
is a live attenuated vaccine.
is like it exposes you to a
Exposes your body to a very mild form of the disease
okay,
that build immunity.
and an inactivated is used
And an inactivated vaccine uses those dead particles,
like the dead virus
the dead virus particle,
to trigger the response.
to trigger an immune response.
Okay.
And what Dr. Bhattacharya highlights here is some fascinating research
That
suggesting that live attenuated vaccines might offer benefits beyond protection
interesting.
against the specific target disease.
Okay, what kind of benefits are we talking about here?
Well, he references the work of epidemiologist Christine Stable-Ben,
Okay.
whose research has explored this very concept.
Okay.
And her studies have found that in some cases,
Yeah.
live attenuated vaccines can reduce mortality rates
Interesting.
from other
Ah.
completely unrelated diseases.
So it's not just about preventing that one illness,
It's not just about that one illness,
but it's like potentially
but potentially boosting your overall immune system
boosting your whole system.
in a way that offers broader protection.
That's amazing.
It is.
Do we know why that is?
Well, there's definitely ongoing research,
Okay.
but one hypothesis is that live attenuated vaccines, because they use that weakened form of the virus,
Mm-hmm.
they engage the immune system
Right.
more broadly,
Yeah.
leading to a sort of cross-training effect
Okay.
that could offer wider protection.
Interesting.
Dr. Bhattacharya specifically mentions the oral polio vaccine,
Okay.
which is a live attenuated vaccine,
Right.
and studies showing it can reduce overall child mortality in Africa
Wow.
beyond its direct impact on polio.
That's incredible.
It is.
It really changes how I think about vaccines.
It does.
Not just
It's not a simple yes or no decision.
yes or no. It's like,
It's a complex landscape
yeah.
with all these individual factors and public health considerations
And even these.
and even these broader benefits.
Yeah. Wow.
And that's what Dr. Bhattacharya emphasizes.
Yeah.
It's about informed decision-making
Th-
based on evidence and a nuanced understanding of the risks and benefits.
He wants us to move beyond
He encourages everyone to move beyond
these pro or anti.
those polarized pro or anti-vaccine stances
Yeah.
and really think critically
Yeah. Just think about it.
about each decision.
This has been so enlightening.
It has been a really interesting deep dive.
But how do we make this actionable for our listener?
That's a great question.
You know, like what can they actually do with this information?
That's the key question.
And maybe how can they apply this to their family as well?
And one we'll explore in the final part of our deep dive.
Okay, sounds good.
Yeah.
Okay, so we've covered a lot of complex information.
Yeah.
about vaccines.
It is complex.
Let's talk about COVID-19 vaccine, herd immunity.
Your live attenuated vaccine.
Live attenuated vaccines, all this stuff.
It's a lot.
It's a lot to take in.
It is.
So how does the listener
how do they
actually use this information?
Right.
Like, what are the key takeaways?
Well, I think that's where Dr. Bhattacharya's emphasis on risk-benefit analysis becomes so important.
Okay.
You know, he's really encouraging us to move beyond those simplistic pro- or anti-vaccine stances.
Yeah, don't get caught up.
Right, and really think critically about each decision.
In the rhetoric.
Right.
Just think about it for yourself.
Exactly.
So, like, asking the right questions.
Asking the right questions, like,
what are the potential benefits?
What are the potential benefits?
For me or for my child?
For you or your child. What are the potential risks?
Potential risks, right.
And then weighing those against each other.
And that's probably the hardest part.
That's the hardest part.
He even says,
sometimes
the medical community
can make this confusing.
Can muddy the waters a bit.
Yeah, like if a doctor's telling you there's like a uniform risk.
If they're saying it's the same for everybody, right?
Yeah.
That should be a red flag.
That should be a red flag.
So it's really about...
It's about being an informed patient.
Being informed.
Seeking out balanced information.
Yeah, doing your own research.
Considering different perspectives.
And
ultimately making the decision that feels right for you.
Yeah.
Based on the best available evidence.
And sometimes that means...
having tough conversations.
Having a tough conversation with your doctor.
Pushing back a little bit.
Really.
Advocating for yourself or for your child.
Being your own advocate.
Absolutely.
So to wrap things up, this deep dive
into Dr. Bhattacharya's insights
has hopefully given you a more nuanced
understanding of vaccines. It's not about blindly accepting or rejecting everything you hear.
Yeah.
It's about engaging with the information thoughtfully.
Yeah, think about it critically. Think for yourself.
And as you continue to explore this topic, here's a final thought to consider.
Yeah.
How can you apply this risk-benefit analysis framework to other health decisions you face in your life?
That's a great question.
Not just vaccines.
But anything.
But any health decision where you're weighing potential benefits against potential risks.
Yeah.
It's a valuable tool for navigating those complexities.
It is.
And making choices that empower you to take control of your well-being.
Great point to end on.
Yeah, thanks for diving in with us today.
Thanks for joining us.